So, second day.
Second day.
You are
Charles.
I'm
Bob.
Dr. Bob Lee, sports doctor.
Right.
And
Charles Pickard, MS4 from Ottawa.
good. So you're doing your sports medicine elective. How's it been for 2 days?
Great. A
Okay.
lot of fun. Yeah.
Okay. So what I wanted to do today, just make give a quick tutorial, answer some questions
Sure.
on honestly a topic that took me personally a long time to figure out.
Okay.
So we'll see how good we are together at figuring this out
As a team.
as a team. And what it is, and probably the body part I get asked a lot. They say, can you quickly talk to us about shoulders,
Right.
rotator cuff?
Right.
What do you think about that as a topic today?
I think it's complex.
What makes a shoulder complicated?
So the fact that, it's a multi-directional joint, there's a lot of ligaments that we don't really pay attention to throughout our training, and we don't really get a lot of examination, skills around the shoulder.
And do patients come in to see you in clinic with shoulder problems?
All the time.
All the time.
Yeah.
So it's a dilemma because you don't really get taught what you need to know probably through med school or residency.
Right.
And then yet these patients come in with shoulder injuries, their shoulder hurts, they fall on it, you don't know what to do, that sort of thing. Okay? So let's go over some. So whenever I give a talk on I get asked to teach shoulder exam all the time.
Right.
And I have a tough time doing it unless we go over basic shoulder anatomy.
Perfect.
Even more so than the knee.
Sure.
So let's figure out, so what does shoulder mean to you? I'm going to write down bones and joints and things like that, so I'm putting you on the spot right now. So
Sure.
go for it. So tell me what the shoulder consists of.
So the humerus.
So we got the, yep,
Which articulates into the glenoid,
yep,
and the rest of the shoulder there's the AC joint, which is the
Yeah.
acromion, and the clavicular joint, so clavicle and acromion.
yep.
And then that's mostly the bony
And missing a
aspects.
big one starts with an S.
Sternum.
Back of your shoulder.
Oh, scapula, yeah.
That's a big one. All right, I think we covered most of the bones.
Right.
Muscles.
So
There's a lot of them.
let's go with deltoid.
Okay.
There's the supraspinatus,
Which is one of 4 what muscles?
rotator cuff,
There's 4 of them. That's the big one.
big one, infraspinatus,
There are 2 out of 4.
teres minor, and then the last one is I know what it looks like. It's like that fanning one that's below the
Yeah.
subscap. Right.
Subscapularis. Other muscles?
So it's
Some
not
more.
traditionally thought of as a shoulder muscle, but the tendon runs through the shoulder of the bicep, so that can
Yeah,
be
I
causing of
do
your-
like biceps.
Yeah.
Just technically 2 muscles. Biceps. Triceps, I'll help you out here, right?
Yeah,
Which is technically 3 muscles. Think,
and then your chest as well, so your
yeah, your pec,
pecs.
pec major,
Mm-hmm.
pec minor. Again, think working out.
Right.
What's this muscle called?
Trapezius.
Yeah. Of which there's actually upper, middle, lower. So there's actually 3 of those. There's a couple more. Latissimus dorsi,
Right.
levator scap. And actually one that you mentioned yesterday. We had a guy who was spasming in this muscle in the back of his shoulder blade. You told me. You said, I think this guy's muscles are in spasm.
I can't recall which muscle I thought it was.
Yes, you do. Starts with an R.
Oh, the
H.
rhomboid.
Rhomboids.
Right. Right. I don't traditionally think of that, but yes.
So, complicated. I'm not going to add all these up, but actually I give a talk to kinesiology students where if you actually add up the muscles in the different groups, there's 18 different muscles that make your shoulder work. And actually,
Right.
1, 2, if you add these up, they add up to about 18. I might be missing 1 or 2, but for our purposes, this is good. So this is Then you look at a knee joint, and you got your quads, hammies, maybe a few ligaments in your knee, patella.
Yeah.
So much more complicated, right?
Right.
So, I'm going to attempt to do something here. I'm going to freehand draw best that I can some pictures here. So let me see what I can do. All right. So this is how I always visualize a shoulder. I want my students to be able to visualize the same thing. Can you draw the anatomy on a blank piece of paper? So I always feel that the stabilizing part of the shoulder is what? The scapula. So draw the scapula first. Then I got the nice glenoid here, which is shallow.
Right.
Remember, it's not a hip joint. It's not a cup and saucer. It's a shallow socket.
Okay.
Then I've got the, what bone am I drawing here?
Humerus.
The humerus. Humerus, like an ice cream cone round, except there's a little bump here. Very important bump. It's got a name.
Greater
tuberosity.
tuberosity.
And I've got a little stick bone. What's this bone called? Everyone knows what this one is.
The clavicle.
Clavicle.
Mm-hmm.
Then I'll draw this bone at the end, called this belongs
Part of the
kind of to this bone here like this.
acromion.
That's the acromion. And this bone connects to the sternum, but I won't draw that here.
Right.
It lives here. So far so good?
Mm-hmm.
It's not bad.
Pretty good.
Humerus, scapula, scapular spine, acromion, clavicle. Okay?
Okay.
Now, so when I see someone with a shoulder, this is what I visualize. I visualize this, so that looks more like the bones in the shoulder. And then I see what muscles make the shoulder work. So let's start with our obvious, what I call your weightlifting muscles.
Right.
So, for my purposes, I don't have room here to draw your pec muscles because they're in the front. I'll leave them out.
Right.
So, what's the big muscle on the side that the bodybuilders want to have good definition?
The deltoid.
The deltoids. So, the deltoid muscles obviously live out here, right? And what's the function of a deltoid muscle?
Abduction.
Yeah. Then you have your biceps muscles in here, and also you have what's the big muscle up here?
Your trapezius.
Your upper traps live up through here. So now I'm going to attempt to draw in the important rotator cuff muscles.
Right.
Which is, the two important ones are?
Supraspinatus.
Yeah. So this is the one you hear about all the time. So the supraspinatus muscle lives in the supraspinatus fossa, like this.
Right.
Comes in through here, forms the tendon, sneaks through here, and attaches onto the tuberosity like this.
Okay.
Through what's called the subacromial space. The infraspinatus sort of lives down through here like this. So this is the supraspinatus, this is the infraspinatus. Okay? The problem with athletes who come in with shoulder pain, they have impingement pain. We do like impingement test,
Right.
Hawkins test. The reason is not as obvious as you think. Athletes aren't necessarily weak. Unless they've torn the rotator cuff, which is a totally different situation than what I see.
Right.
You see, I don't really see people with really torn rotator cuffs. They just have shoulder pain. And the problem that athletes get into is that they get an imbalance, meaning athletes typically work out, so they get strong deltoid, trap muscles, they're big lifting muscles. And if you look at the force vectors, what the deltoid does is not only abduct,
Right.
as it abducts your shoulder out this way here, it's got a net force vector that goes in an upwards direction. Does that make sense to you?
Yeah.
So you take your arm, you lift it up to the side. The humerus wants to get pushed up
Yeah.
as you're lifting up. Your body depends on your rotator cuff muscles to stabilize the humeral head, to bring it down inwards and downwards. Make sense?
Yeah.
Now, I've drawn this as a big arrow. I've drawn these as little tiny arrows because these muscles are wimpier. So you have to have good muscle balance so you don't get into trouble with something we call impingement. So I'll write it out here. So you've heard that term before, right?
Yeah.
So where does impingement occur?
If I had to guess, I'd put it around here.
Right. Impingement will occur in the subacromial space. Right in there. There's a bursa sac right there,
Okay.
and then tendon gets pinched. So, if these rotator cuffs aren't firing as you lift your arm out,
Yeah.
I'll see if I can wing this. As you lift your arm out to the side, so now his arm's out like this, right?
Yep.
What happened to that bump? Where's it going?
Pinch down the tendon. there.
Pinching. Because your arm wants to go up. So you get this impingement syndrome right there. How do you stop impingement from happening?
Strengthening the rotator.
Strengthen the rotator cuff muscles. Okay? Complicating matters is range of motion. If you have a
Right.
tight shoulder to begin with, then the whole shoulder's tight.
Right.
So you can get impingement just from not having good range of motion, which is what do we emphasize when I do the physical exam? That,
Range of motion.
yeah.
Yeah.
Specifically, what do I keep saying? What range is the most important?
Flexion. I would say abduction.
It's everything. Flexion, abduction, rotation,
Right.
internal rotation. How's it going?
Good. How are you, Dr.
Good.
Lee?
So I'm just going to practice doing just a really quick physical exam on your shoulder.
Sure.
But I'm just going to bypass inspection and palpation and
Okay.
just go to some of the more specialized tests.
Mhm.
So what's important for me when I look at a shoulder is I want to see that you can do range of motion. So let's just, easiest way to teach physical exam is just mimic what I do, okay? So what I want you to do is, let's see what your range is like in forward elevation or this movement here. So go
Okay.
ahead, show me both arms. Right up. Good, that looks normal, and then back down again. And keep going backwards through the plane into extension, good, and back down again. And side abduction, I call it, arms straight out to the side, right up, and then back down again. Good, and then put your arms at your side here, and you can sort of do rotation this way, so I want you to turn out this way here, and then come this way here. And you can't go through your body, so visualize you've gone through your body to the other side, so turn around here. So this hand has come through the body, and let's see how high you can scratch up this hand up, as high as you can go, and put this one down, and how high you can scratch this one. So I already notice you're better with your left side, and you're less with your right side, which is almost everyone's dominant side. So your right hand.
That's true.
Good. So I'm going to test strength of rotator cuff muscles. So we'll start with supraspinatus, and for you, I can do it this way. So I want you to I want you to resist me. Don't let me move you. So as opposed to asking you to lift up, so just put pressure. Keep going. Come on, as hard as you can. Good job. Good job. Okay. And put your arms out here. Turn your arms a little bit. Same thing for infraspinatus. I want you to just hold that position. Don't let me move you. Don't let me move you. Good. Okay. And I'm just going to show one test, the Hawkins impingement test. I use this test all the time. A lot of my throwing athletes, when they throw a ball, they have pain on that follow-through phase. So they impinge on their shoulder, just like on that diagram. So I'll bring it up like this, about 45 degrees forward. I support the elbow. Just let me do all the work. So let me take your arm up, and I'm just going to put a little gentle pressure. How's that?
Yeah,
Okay?
definitely feel that.
All right, so there's more tests, but we'll just stop there.
Neil? Charles,
Hey.
nice to meet you. I'm a Click from Ottawa. Do you mind if we do a quick shoulder exam?
Yes.
All right, so let's start with range of motion. We'll skip over inspection and palpation for this exam. So forward flexion, as high as you can go, and that's great. And then down into extension, perfect. And then we'll do some abduction, great. And some adduction, good. we'll do some internal rotation. So you're gonna do like me in just a second. So reach your hand as high up your back as you can. So let's see how high you can do each arm. So that's good there. And then your other one. Very well. And then I like to do external rotation by just asking the patients to put their hands behind their head. And that's usually a good indicator of fairly normal external rotation of the shoulders. And then we'll test some strength. So the first thing I'll do is I'll do some resisted internal and external rotation. So hands at the side like this, and don't let me push you in. So this is resisted external rotation. And then the opposite, I'm gonna put you like this, and don't let me push you out. Good, so resisted internal rotation. We can do resisted abduction. So hands up like this, and I'm gonna try to push you down, and you don't let me push you down. So this would be testing for more of the supraspinatus. And to isolate it even further, I can get him to rotate his hands like this, bring it slightly forward, and again, testing for some impingement of the supraspinatus. We can move into some other special tests now. So I can do Hawkins to also test for supraspinatus. So standing in front of the patient, bring their elbow just slightly above their shoulder at about 45 degrees. And then you just want to apply some gentle downward pressure to the wrist a couple times, and they'll let you know if they're feeling impingement pain similar to what they previously experienced. If you're concerned about an anterior dislocation, you can get patients sitting down because usually they'll be more uncomfortable, but just for the sake of this room, if you get their arms up and you try to rotate like this, that's generally a positive apprehension test. So if you're concerned about the AC joint, you can do a crossover test. So you can ask them to sort of put their hand as far as they can up towards their other shoulder, just like this. And usually they'll get pain over the AC joint if there's any injury to the AC joint, which is a great test to test that.
So how's that for an intro to shoulders?
It was great.
Yeah. Does this now make sense?
Makes
as
a lot.
far as why that Hawkins impingement test works? Because if
Yes.
someone has weak rotator cuffs, the shoulder lifts up, and you're pinching them and you're scraping underneath the subacromial space, especially if they have a bursitis,
Yeah.
or they have an inflamed tendon or partial tendon tear, that targets the subacromial space.
Yeah, and you can absolutely see why sort of strengthening the rotator cuff is the part that we really need to focus on. And a lot of people get focused on this area, but they think this is part of their back, and they neglect that when they have a shoulder injury like a impingement.
Okay, so how about tomorrow, part 2, we do investigations
Yeah,
and then treatment options.
cool.
Great, thanks. Good job.